Nominations are now open for the 2017 Bioceuticals Integrative Medicine Awards, the BEMAs. As healthcare practitioners, we care for our patients, and while our therapies can have a major impact on them, there are few opportunities for us to celebrate our success stories as a profession. Now is the time to have your contribution to integrative healthcare recognised. There are many different categories and, as usual, great prizes to be won. For more information, go to the Education tab at bioceuticals.com.au. This is FX Medicine, and I'm Andrew Whitfield Cook. Joining me on the line today is Dr. Denise Finesse. She conducted her PhD in Nutritional Genomics and Genome Health at CSIRO Human Nutrition under the mentorship of the esteemed Professor Michael Fenwick. Denise has been involved in genetics and nutrition health research for over 12 years and was principal researcher in the Predicting Adverse Pregnancy Study, PAPO study, at the Women's and Children's Health Hospital in Adelaide. Her interests include the diagnosis and treatment of underlying conditions such as detoxification, inflammation, oxidative stress and methylation. Denise works closely with integrative practitioners in order to apply this knowledge and address the possible underlying issues associated with various health concerns, including fertility, gastrointestinal disorders and mental health. Denise, welcome back to FX Medicine. How are you?
I'm well, thank you. Thank you for that long-winded explanation and introduction. That was very nice of you to go through all of that.
That's not long-winded. I've cut so much out. You've done heaps. But, I mean, that's only one study that you were involved in. You were involved in another study, weren't you?
So my PhD project was a high-risk cohort funded by the NIH, so that was just a high-risk pregnancy study. I was also involved, though I definitely wasn't the principal investigator, but I was one of the investigators in Adelaide in the SCOPE study, which was a huge international pregnancy cohort, and obviously have done a lot in the nutrition world as well. So and the fitness world. So I work in fitness and have a sort of special interest, I guess, in women's health and pregnancy, but also just general fitness. So not right now because I'm only a few weeks off having a baby, but when I'm at my best, I'm teaching RPM at the gym, out there pumping iron, and
mind you were still pumping iron. I mean, you're expecting in less than a month, is it?
That's correct. Yes, we got a baby coming soon. Yay!
But you were still doing squats.
I was training 3 times a week when I saw you. So I've had a week off because I've been a little bit unwell and
lazy.
I'm feeling quite heavily pregnant. But I do plan to go back tomorrow morning. My training is backed off hugely compared to what it was. But I'm definitely it's not just about the nutrition and avoiding toxins and chemicals, which we'll talk about today, but also exercise, I believe, is very important.
Absolutely. And indeed, we're talking today about doing a genetic detox profile, one fraught with controversy in the medical world. But the thing that interests me about this controversy is, well, hang on, isn't the greatest evidence for genomic testing in drug detox?
I'm biased because I don't do drug detox, testing. So I would say there's a lot of genetic testing around, other areas such as all those things you were discussing in the introduction. So the methylation, the inflammation, the oxidative stress. But you are correct in saying that we do have a lot of evidence around all those cytochrome P450 genes that code for enzymes that break down medications, and then we can determine how someone may respond to a medication based on genetic variations within these enzymes. There's also a lot of research around particular genetic variations for disease, so that's sort of diagnostic genetics as well. But
right.
I obviously don't work in that area either. I'm not sort of diagnosing rare genetic diseases, more looking at genes that have a functional effect in sort of these underlying pathways that could relate to a chronic inflammation, which could impact on obviously so many health conditions, methylation, folate metabolism, fertility, etc.
Mm-hmm. I do sort of pick up that the detractors of genetic testing or genomic testing, let's say, SNP testing, it seems like a bit of a turf war to me. It's like it's okay for drug testing because that's what we prescribe, but it's not okay for everything else because we can't prescribe something for it.
I guess, to be honest, I'm surprised that the drug testing isn't bigger than what it is.
Yes.
So when I first learnt about this, I moved from research into clinical practice about 4 years ago, and actually Professor Les Sheffield, his son, came out and spoke to us, the medical practice I work at, and explained about the testing that they were doing. And I thought, this is amazing. Every single doctor will take this up because I'm obviously inclined to do genetic testing and I guess have a background in the area. But I don't think it's been taken up as quickly as I thought it would have. There are definitely practitioners that utilise this, but I don't think it's as widespread as I expected because it has been around for a while. There is hard evidence. I guess the other thing is that until perhaps it's subsidised by Medicare at the moment, it still is costly. And because of that, it's not mainstream as yet.
But I think, as you say, like particularly with pig-headed drugs like warfarin and, a drug that you definitely want to work and you want to know that it's going to work, like tamoxifen, if only for those two drugs, I am surprised that it's not taken off much more than what it has.
I agree with you wholeheartedly. As soon as when I first heard about it, I thought, this is amazing. Everyone will be doing it, particularly in the world of mental health. A lot of people have, side effects or they don't benefit. They wonder why, or in some cases, the side effects are quite serious. So in this case, where we do know a lot about these particular cytochrome P450s that are utilised to metabolise particular drugs in relation to mental health, for me, that seems like a no-brainer. Why wouldn't you? And unless the person is, really financially struggling, I'd imagine that if the patient understood, they would pay for this because all they want to do is feel better.
Yeah.
So why almost use themselves as a guinea pig to trial medications? Because particularly with the mental health patients that I have spoken with, they're often sort of, changing this medication, having this, and it's not the best way to do things, I think, when we have evidence that could stop a lot of this, and they should be directed in what medication will be best for them based on their genes.
So I've got to ask, we're going to be talking not about the drug detox profile, but indeed, I'm not going to say a functional detox profile because that will confuse practitioners, but a genetic SNP detox profile with regards to other agents, things in our lifestyle. Tell me what you test for and what's the relevance, what's the evidence indeed about these things?
So when I'm thinking about detoxification, or a patient comes to me and we think there may be an issue with toxins or chemicals, and this would be based on things like symptoms. For example, they're sensitive. They're sensitive to foods. They're sensitive to creams they put on their skin. They breathe in fumes. They get headaches. They're unwell. So they're chemically sensitive. So we can tell often just from someone telling you about their symptoms, but also we can test so many things these days. You can find out, does someone have high levels of benzenes, which are things found in exhaust fumes and industrial pollution, things like that. But also, do they have high phthalates, things that come in plastics, parabens, particularly for women. So a lot of the preservatives found in a lot of women's skincare products have parabens. And these are highly debatable on whether they are safe or not.
Yeah.
So we can either go from, I can either sort of listen to the symptoms, or we can do further testing and find out if someone does have high levels of these things. And then this would direct me to think, well, let's find out why this person is more vulnerable. Why are they susceptible? Aside from the obvious, if it's benzene and they're living next door to a petrol station,
it's duh.
Then we can put the pieces of the puzzle together. But otherwise, what we do is we start to investigate a little further. And the genes that I look at are involved in phase 1 detoxification. So I mentioned before about cytochrome P450s. These are our phase 1 detox enzymes. There's a whole family of these, and what they do is they sort of convert the chemical into often what is more toxic than the original substance. So phase one, we've got phase one, then we've got phase two. Phase two, sort of the clearing, helping sort of neutralise the toxins and chemicals to sort of excrete them from the body. But sometimes people have genetic variations in the cytochrome P450s, and this actually speeds up the activity. And when you think about genetic variations, we often refer to variations that slow the enzyme activity. So you think there's an issue with sort of slowed function, and you may not get the proper activity of an enzyme or a transport or a receptor or something. But in this case, the genetic variation that has a negative effect are those that speed up the activity because you're getting more of these toxic metabolites. And then often people have issues with phase two because of genetic variations in things like glutathione transferase enzymes, which mean they're working a bit slower, or poor diet. So they're not getting things that are going to support that phase two. So the glutathione, but also even anyone that has gastrointestinal disorders, they're not absorbing their nutrients. That's going to affect the detoxification as well. So we're looking for these genes that may make them more vulnerable. The other thing, aside from looking at genetic variations within genes that are directly related to detoxification, I also look for genetic variations in antioxidant enzymes. So there are enzymes like superoxide dismutase that we know are very, very powerful antioxidants. And there are genetic variations that have been shown and that we can test for that show the activity is slowed down, which would mean that person's ability to naturally deal with oxidative stress is not as good compared to someone who didn't have the genetic variation. So if you've got the toxins, the effect of those toxins is usually, higher oxidative stress, and then that high oxidative stress can lead to, inflammation, and that's when you sort of get this sort of vicious cycle of things going on in the body. People becoming more sensitive, feeling unwell, etc.
I have to ask, why would you choose to do SNP testing of detox profiles rather than, let's say, a functional detox profile? What's the difference and the clinical importance of either?
So I guess, number one, we want to find out often the why. Why does this person have higher levels compared to someone else? And the genetics is part of that. The diet's part of that. Exercise, I mentioned I'm an exerciser. If you're an exerciser, you naturally upregulate, so switch on your antioxidant enzymes, so you've got a better ability to deal with oxidative stress. So aside from talking about all the lifestyle stuff, the genetics help someone to understand why they may be more susceptible. So number one, I personally believe and see that patients have a feeling of empowerment, or just when they understand and have some knowledge about why things might be happening. Because often people think, what the hell is wrong with me? Sometimes people think it might even be in their head when they've got multiple things going on and the next person doesn't have these things. So you're able to explain to them, which makes them feel better. On top of that, you're able to then provide advice, personalised advice on their genes, whether that is exercise. So I do talk about exercise in relation to oxidative stress and antioxidants, but also particular nutrients. I mentioned the superoxide dismutase, the particular genetic variation that is well known and that we test for that has a functional effect is within the MN SOD. So we know that manganese is something that's required for this enzyme. So manganese isn't something that we commonly test for, but there are times when, someone really is having some issues with chemical sensitivities. We can see certain things going on with, and they've got high oxidative stress. They also measure hydroperoxide, which would give us a marker of oxidative stress. I might then go and say, well, let's have a look at your manganese levels based on knowing that the MN SOD may not be functioning as well, and then we can give manganese. Or in the case, sometimes people won't test manganese, we'll just give a small amount of manganese or antioxidant type supplements that specifically work with these genes to promote the function. So when I talked about the glutathione the glutathione transferase enzymes before, we may think that someone really needs to support that production of glutathione. So whether you're going to give something like NAC, because we know cysteine's a limiting factor in producing glutathione naturally, or there's now these, liposomal glutathiones that are meant to be, highly effective. So you may want to support like that if you think the issue is around that phase 2 detox. So doing the genes helps you work out what areas particularly need support, and then you treat based on that. So that's sort of personalised medicine.
So to differentiate it from a functional liver profile, a detox profile, this would give you more of a clue into what areas particularly need support. The other one tells you in general how the, let's say, the general funnels of detoxification are working. Would that be the right?
Yes, and also the other thing is that so for example, as we're talking about, I mentioned sort of benzene, so a lot of the cytochrome P450s, the common ones that have genetic variations like CYP1B1, CYP1A2, which we know for caffeine, and the CYP1A1, but even the 1A2, it doesn't just metabolize caffeine. Anyone that's done genetic testing will probably think of CYP1A2 as caffeine metabolism. That's how it's reported, but it doesn't just metabolize caffeine. It, along with the other CYPs that I just mentioned, also metabolize things called polycyclic aromatic hydrocarbons, including some of the benzene. So if people have genetic variations in these, we can tell them that genetically they don't deal with particular chemicals as well as someone else.
Right.
So when I was talking about the education side, not only is it about treating, it's saying, okay, well, you don't deal with this as well. So you need to consider this. Are you living near a freeway? If so, you probably want to move, because it doesn't really matter how many supplements we give. Taking away that chemical or toxin that you don't deal with as well is going to be the best thing we can do.
Yeah.
And the caffeine too, even the CYP1A2, discussing that with when people are fast or slow metabolizers, it's a bit like with the drugs or the chemicals. The body treats caffeine like a drug. So we can talk to people and say, well, this is why that you don't tolerate caffeine very well, because I have to admit that it's pretty clear cut. Every now and again, someone will come in and tell me they're drinking coffee, even though they've got the variants associated with slow caffeine metabolism. But majority of the time, the people will be sitting across from me and say, I can't tolerate it. I get palpitations. I can't sleep. So you're able to sort of educate them on why and what chemicals or particular toxins and things they should be avoiding as well.
Thing that springs to mind for me when you were mentioning 1A1, 1A2 is estrogen metabolism. So
yes,
I dare say,
very much so.
Yeah, you're getting these. I guess the picture that's forming in my mind is this may answer why certain treatment, I don't like this word protocol, so certain treatment approaches to hormonal issues in women may work for some women really well and may not work for others. They might be, recalcitrant in their benefits, if you like. They just don't get the benefit when you say do the same approach.
Exactly. I'm really happy you put it in those terms, because this is really what this is about. Why do some people benefit from some things and why do they not? And that's because a lot of it is to do with our genes. So when we talk about the estrogen metabolism, I do a lot with women's health. So whether we're talking about fertility or endometriosis or a lot of sort of estrogen dominant, even weight. So I do a little bit of work in the fitness industry with women that compete at a high level, and they need to get their weight down before they're doing certain competitions. And estrogen is known to be associated with sort of fat deposition in particular parts of the body. So I do a little bit with estrogen metabolism for various health and aesthetic reasons. And I will be looking at the cytochrome P450s that you mentioned, but also then the phase 2 with the COMT. So we know that COMT, catechol O-methyltransferase, uses a methyl group to sort of excrete some of those estrogen metabolites. So if someone's got genetic variations in the phase 1 enzymes that are involved in estrogen metabolism and in the phase 2, they're more inclined to not deal with estrogens as well. So then I can, talk to them about things like, are they on some type of contraceptive that's got a lot of estrogen in it?
Yeah.
Because perhaps that's not right for them. Are they exposed to xenoestrogens? What kind of lifestyle are they living? Are they having enough of the Bs, which is going to help with methylation and excreting, estrogens, things like that. So it's not just about getting rid of, chemicals and toxins. Hormones are chemicals, endogenous chemicals as well. So this is a lot to do with hormone metabolism as well.
Can I ask then, is there, genetic SNPs? Are there genetic SNPs that indeed when somebody has, forgive my ignorance about how I speak, but let's say they have the double allele, and indeed what it does is get rid of things like estrogen too much, so that they might be at greater risk of having lower circulating levels of estrogen and therefore not gaining benefit in, or having greater risk of, say, osteoporosis or cardiovascular disease. Yeah, do we find that?
I don't think that if someone had a genetic variation, they would clear too much estrogen based on their genes. However, anyone that is living a certain lifestyle and not eating enough and exercising too hard will have, without a doubt, lower estrogen because it's related to fat mass. So there are definitely things that will affect that, but I'm not. Genetically, it's more to do with the enzymes involved in that, or the COMT really, which is the main one we know about, the phase 2 clearing. You either sort of have that normal function or, well, actually it can speed up or slow down. The answer is I don't think so, but let me do some reading. I don't think so, but a good question.
Oh, God. Hopefully ask some good questions. But
good question. I'll have to go. I do some reading.
So again, on another note, there's been other examples where indeed a SNP might have a protective benefit.
No.
Does that occur with detox?
Yes. So, all of these things, we talk about, the variants, which, sometimes do offer a protective benefit. It may not always be sort of the negative thing, but the variants, we're often talking about how this may sort of have a negative impact. But even if you don't have the variant, so in the odd occasion, the variant can offer some benefit, but even if you don't, there are protective things. So when you think of something like cancer, this is definitely not an area I work in, but anyone that is interested, there's actually, can't think it off the top of my head, but if you did some Googling, there's a great government website that talks about genetics and cancer, and it actually has a PowerPoint presentation that you can flick through, and it goes through, what are genes, what are alleles, what are SNPs, and it talks about various SNPs in relation to sort of detoxification and cancer. And it's really good for people that don't have an understanding of genetics, because the graphics and the way they explain it is very good for the lay person. And what it shows is that if someone could be living, and anyone that's actually seen a lot of my presentations, I actually got permission to use a couple of their slides because they're really good. But it shows the difference between, two young guys living a completely similar lifestyle. They're drinking and they're smoking, they're probably at uni having fun. But then as time goes on, one goes on to develop cancer and the other one doesn't, despite them having, similar amounts of alcohol and tobacco, completely different outcomes. And what it relates it to is it talks about these difference in the detoxification SNPs. So someone may get lung cancer and have been a smoker, or even just be more sensitive to secondhand smoke, whereas someone else could be a smoker and not develop lung cancer. But one of the possible reasons could be that they don't have a lot of these genetic variations in the SNPs. Their ability to deal with the chemicals in that cigarette are much better than someone else's. Plus, on top of that, not only do they have the genes that are helping support that, they've obviously don't have other things. Perhaps they're not as stressed. Perhaps their diet is a little bit better. Perhaps they're an exerciser, so they're sort of switching on all those antioxidant genes and deal with the oxidative stress a bit better. But when we do think about things like, cancer and chronic conditions, our genes can either, we talk about risk, but they also can be very much protective.
So to me, like a couple of things floating around my brain when you mentioned that scenario, two guys, similar alcohol, bad lifestyle, quote unquote. One has the ongoing issues, health issues. One doesn't. One might have what we used to call the bull physiology. But eventually those protective processes will break down. Let's say cigarette smoke, like one gets cancer early, one gets cancer late. They're still bad.
Yes. But I wouldn't say that it's protective in the sense that we all have a threshold, and even if you are genetically stronger or, genetically you're able to deal with things better, reality is there is a threshold, and as we age, everything, basically our genes don't work as well. So what happens over time is that we sort of develop more and more what's known as DNA damage or genome damage, and that means that, and that's part of aging and getting all the wrinkles and things as well. Our cells aren't turning over as quickly. Our DNA isn't replicating as well. So even if you are genetically stronger, that doesn't mean that you aren't going to have some health impacts later on in life.
Yeah.
It just means that you're likely to avoid them for a lot longer.
Yeah, that's right. So to me, I wonder about what I'm thinking here is who should have the test. So I wonder if you see these sort of patients that, they might come and present to you with the words like, oh, my friend drinks all the time and I drink all the time, but they're always fine and I'm always sick. And they're constantly telling me, oh, you're always sick or you're always having issues with this. And so I know this is a biased sort of sampling, I guess, but do you ever see that? Like the patient who presents saying, oh, I'm the one who always gets this.
To be honest, I guess I've been doing this so long now, I almost think I can tell what people are going to have when they sit down in front of me, and when we start the consult, I'm like, okay, yeah. And I'm not always right, but a lot of the time you are. So I can sort of think, okay, there's stuff going on here with, detox, or there's stuff going on with methylation, or there's definitely an inflammatory thing. Someone comes in and they're talking about pain in their knees and their hips, and they've got, asthma and eczema or something. I'm thinking, all right, this is probably going to be all around, inflammation and things like that. So I do probably start to do a bit of an analysis, and because getting a really good case history is so important as well. It helps direct where you want to go. With the genetic testing, I guess because this is what I am known for, it may be different for other people that haven't come from a genetics background. They may only do this for select subpopulations or select patients in their clinic. But for me, I really do genetic testing on almost everyone, because that is really, I guess, sort of my niche area. I work with 4 integrative GPs, and any of their patients that are wanting genetics will sort of be referred on to me. Plus, I guess it's such a growing field. There's not a lot of people in Australia that are doing this. Well, they are. It's growing, but it's still hard to, I think, find practitioners that are really delving into the genetics. So a lot of people actually come to me because they want genetic testing done, and there's so much information on the internet these days. So people are generally contacting me. Anyone that knows me knows I can be a bit hard to get onto. I don't even have a website or anything yet, but it's sort of, I guess the word has spread about me doing the genetics, and people are coming and wanting it. So almost every patient that sees me is going to get genetic testing, one, because they want it themselves, or they've been referred by a doctor because they think this is the next step to try to understand whatever their health concern is. My passionate area is sort of, the women's health and the fertility stuff. So I come from that area. And for me, the genetics is really important in that. I think that even if someone didn't know about genetics, they were seeing me for fertility, so they're probably the two main things that come to me is fertility patients and genetics. Yeah. I would be recommending genetic testing. And it's one thing that you only have to do it once, unlike some of or other tests where you sort of want to follow up and monitor. Someone's low in vitamin D, we want to find out, is the vitamin D now higher? You might do another one in 3 months' time. With the genetics, once it's done, it's done. They can revisit their results. They can revisit their summary from me to understand, about their strengths and weaknesses, if I can sort of simplify it like that. So
you specialise, as you said, in genetic testing all the time. For practitioners that are just in normal everyday practice, when would they say, hey, listen, we should really be looking at a genetic profile for detoxification, say?
So I think these are the kind of tests that you bring in when you have your complicated patients, the ones that don't seem to be getting any better. Yep. Why aren't they getting any better? Why isn't it, every practitioner has their area of specialty and a way they practice that may work for them, but sometimes things don't work out that way. So you need to delve a little deeper. That's when I would be looking at the genetics. Also, when someone actually just wants to know why, because it is a great tool for having that deeper understanding of your own body and how it works. And again, as I said, for patients that don't seem to be, it's probably not something you might do straight off the bat, because particularly if the patient doesn't know much about it, it might be a bit intense to just say we're going to do genetic testing. But if you've been working with your patient for a little while perhaps they've got these chemical sensitivities, whether it's to, foods or creams or the things that I mentioned earlier, you may say, well, I think that we should do some genetic testing here to find out, are you, more vulnerable? Let's have a look at your risk. And if you are at risk, what are the chemicals that, you don't tolerate as well? And then what can we do to address that? Because it's not, even if someone is, say, particularly more sensitive to benzene, it's not just the benzene that's an issue. Once you start to get this higher toxic load, then you become almost sensitive to everything because your detox system is overworked. So you want to be able to identify those things and really and help that patient learn what they need to avoid, as well as then, as I said, that the nutrition is also key as well. I can't say enough about diet, and I'm fairly certain that most of the listeners that you'd be getting would already know this. The diet is key, but this can help you tailor, and discuss things like antioxidant-rich foods, things that are going to provide support for that phase 2. If it is a hormonal thing, discussing the methylation and the B vitamin. So it helps you sort of guide and tailor their nutritional intake as well as prescribe supplements. And, with most patients, I am prescribing supplements. That's the way that I work. I don't intend for them to be on them forever, but really to give their system a boost and help them get well, really.
Denise, would you be amenable to delving into the various SNPs that one would be testing in a detoxification profile at a later stage, and we might go through the various types of things that are tested for and what their clinical relevance is?
Absolutely. We could do that. We could talk about the particular SNPs. I've obviously touched on some briefly, but we could go into a bit more detail or perhaps even think about a case study or something like that to try to add a bit of a practical touch to it.
Lovely. Perfect. Thank you so much for taking us through the relevance today and, when you wouldn't choose testing, because I fully agree with you. Like, I think there'd be a lot of cases where you think, where you would consider genetic testing for detox if it's the chronically unwell patient. But there might also be those times where you'd say, let's use this as a foundation so that we know that we can direct your therapy and get the best results for you. Straight off the bat, rather than wasting therapy,
As I said, particularly for those of what I call the sensitive patients. When someone comes in and they're highly sensitive, that's telling you straight away there's something going on with detox. So if you can get to some of these underlying, causes or associations, causes may be a strong word, but, get to some of these underlying factors that may be associated with this, then you are addressing these directly and helping them, possibly quicker than if you were just sort of doing trial and error.
Brilliant practice tips. Thanks, Dr. Denise Finesse, for joining us again today on FX Medicine. I love speaking with you.
I love talking to you too, and I look forward to our next chat. Bye, everyone.
This is FX Medicine, and I'm Andrew Whitfield Cook. The 5th Bioceuticals Research Symposium will be held from the 21st to the 23rd of April 2017 in Sydney. This promises to be another sellout event. For more information, including registration, go to the Education tab at bioceuticals.com.au. This is Andrew from FX Medicine. We thank you so much for your support over the last 2 years. We'd really love to remain clinically relevant to your practice. So if you know of an expert in some area, please let us know. You can contact us on fxmedicine.com.au, Facebook or Twitter.